So good afternoon, everybody. It's right at the noontime hour, maybe a minute past, but we are going to get started on our SALT Talks Lunch and Learn. For those who don't know who I am, my name is Patty Schramm. I'm the Parent Resource Coordinator for the SALT Talks. This month, we have been working on benefits and services. So last week, we started with a part one of Social Security. Next week is part two of Social Security. But one of the pieces of all the benefits, and it ties into so many things. A lot of these topics overlap with each other. So tonight we're going to be looking, or tonight, not tonight, today, noontime, we're going to be looking at just understanding Medicaid, Medicare, just these types of benefits and how they with work and employment and just how they work with our individuals. So we have Latosha.olinger and we have Jeanne. Your last name, is it Ehmke? I'm not sure if I said that right.
Ehmke.
Ehmke, okay. Jeanne is with OOD and Latosha is with the Warren County Board of Developmental Disabilities. And they've given this presentation a couple times, but I thought it was very important to insert it at this point during our month looking at the benefits and services. So I'm going to go ahead and turn it over to whoever wants to start. And if there's any questions we'll watch the chat box. Whoever's not speaking, maybe watch the chat box too. And we can address your questions as we go, or maybe if there's a few minutes at the end, we can open it up for discussion. But I'm going to turn it over to Latosha, I guess.
Yes.
Okay.
Thank you so much, Patty, and thanks everyone for joining us today. My name is Latosha.olinger. I work with Warren County Board of DD Services. I'm a work incentive coordinator with the county board, and I have my friend Jeanne Ehmke along with me. She's from OOD. She'll be providing some information regarding Medicaid as well as we move throughout the PowerPoint. Today, we're going to present information on a couple different categories of Medicaid. There's several categories of Medicaid, but we're only spotlighting a couple today. We decided to spotlight the ones that we primarily see our individuals that we're serving become eligible for. If you have any questions, please feel free to type in the chat or wait to the end to ask your questions out loud. So the first agenda today is we're going to discuss age, blind and disabled Medicaid, SSI Medicaid, home and community-based waiver services Medicaid, 1619B Medicaid, and then the Medicaid buy-in for workers with disabilities program. Next slide, please. So let's discuss what is Medicaid. Medicaid is a public health care program funded by the state and federal government. It provides necessary health care coverage to children, pregnant women, families, adults age 65 or older, and people with disabilities who meet eligibility requirements. Some individuals may receive free Medicaid health care coverage. Others may be required to pay a monthly premium or copay for certain services due to income. Next slide, please. The first Medicaid category we're going to discuss today is called age, blind, and disabled. If you're talking to Job and Family Services, they may just refer to it as ABD Medicaid. So this is Medicaid coverage for older adults, blind, disabled with limited income and resources. To qualify, you must be age 65 or older, legally blind or disabled. In 2025, have countable income below $967 for an individual, and for a couple, $1,450. And that's per month. The resource limit for this Medicaid category is $2,000 for an individual and $3,000 for a couple. Due to the sake of time, we did not go into all the details, but we did provide links where you can find out additional basic requirements regarding this Medicaid categories and all the Medicaid categories that we're going to discuss today. So those links are highlighted for you. So if you go back later to view the PowerPoint, you can just click on each link for additional information. Next slide, please. This next category of Medicaid is called SSI-based Medicaid, and this Medicaid coverage is for individuals entitled to SSI. So typically when someone is approved for SSI benefits, they're automatically approved for Medicaid as well. I do share with individuals that I work with, if you become eligible for SSI, typically the Medicaid application is submitted through the SSI process, but sometimes things could, you just might want to check Job and Family Services to confirm that the SSI application was submitted as well, and check your enrollment. If for some reason Job and Family Services indicate that they do not see an application for you for SSI, just go ahead and take the steps to complete the application for Medicaid and go through the process, and the individual will become entitled if they're receiving SSI benefits. With this Medicaid category, you do have a resource limit for $2,000 as well to maintain eligibility. For additional information regarding this level of Medicaid, you can visit this link below later on when you review the slides later. Next slide, please. This next category of Medicaid is called Medicaid Home and Community-Based Waiver Services. And there's several different Medicaid waiver programs, and we have them listed here. So the Medicaid waiver allow individuals with disabilities and chronic conditions to receive care in their homes and communities rather than long-term care services. So a lot of individuals that we work with are on a developmental disability waiver, and that includes the individual option waiver, the level 1 waiver, and the self waiver. We do come across some individuals that we may work with that's on the Ohio Rise waiver, or maybe on a home care waiver. And if they're a little bit older, there could be potential eligibility for the passport waiver or assisted living waiver. Typically, you're only eligible for one waiver. Typically, there's not eligibility for two at the same time. For additional information regarding each waiver, you can click on the links that's provided. Next slide, please. To be eligible for a home and community-based waiver, you must meet the level of requirements for that waiver. You must meet the level of care. Also, you must meet the income guidelines for it. So currently for 2025, you must have countable income less than $2,901 a month. And if for some reason you have income above that amount, there is options for you to not enroll, I should say, to create a qualified income trust to set aside the excess income that you have to meet eligibility, and the income that you put into that qualified income trust will help you become eligible. And then you could use some of those funds to spend on medical needs. But those funds will have to be those expenses, should be approved by Medicaid for use. And there is a resource limit for $2,000 for the home and community-based waiver, unless you are receiving another category of Medicaid that we're going to discuss a little bit later. Next slide, please. The next category of Medicaid we're going to discuss is called 1619B, Continued Medicaid Coverage, and this for individuals who are on SSI. This provision continues Medicaid coverage for working SSI beneficiaries. It provides coverage at no cost if earnings alone or in combination with other income are too high to receive SSI. In 2025, individuals can have an annual gross earnings up to the threshold amount of $46,314 to be eligible for 1619B Medicaid. To qualify, the individual no longer meet the eligibility for SSI due to earnings. They still have disability and continue to meet the Social Security definition of disabled and have a need for the coverage. So the individual, if for some reason Social Security would ask or Medicaid would ask, do you need Medicaid coverage? The individual will have to say, yes, I do have anticipation on using this coverage to continue this coverage under the 1619B. The resource limit for this Medicaid coverage is $2,000 as well. We did provide a link here where you can gather additional information. Next slide, please. The next category of Medicaid we're going to discuss is called the Medicaid Buy-in for Workers with Disabilities Program. This allows individuals with disabilities who are working to qualify for Medicaid with higher income and resource limits and buy into the Medicaid with paying a premium. But some individuals may not have to pay a premium. It's really based on their income. To qualify, you must be a U.S. citizen and meet the resident of Ohio requirements, be between age 16 to 64, be disabled, and be employed paying taxes. You must meet the financial guidelines for the program. Annual countable income must be less than 250% of the federal poverty guideline. And for this year, 2025, that amount is $39,132. There is a higher resource limit for this Medicaid program compared to the other Medicaid categories we just discussed. Under this program, individuals can have up to $15,210 of resources, and that would include like money in the bank, savings account, checking account, stocks, bonds. This limit typically will increase every year. Some individuals may be required to pay a premium based on their income, family size, and other deductions may be applied as well. There is additional program that was just recently established back in October of last year, and it's called the Workability Program. And this is very similar to the Medicaid buy-in for workers with disability program, but it's for individuals who are age 65 and older. We didn't go into detail when it comes to that because one is very similar to the Medicaid buy-in, but because this is focusing on Transition U, we didn't think it was necessary to kind of go into details. But if you want more information on that, feel free to reach out to us and we can provide additional information. Next slide, please. So now we're going to discuss Medicaid and some employment examples and how employment may impact Medicaid benefits. I'm now going to pass it on to Jeanne, where she's going to provide you with additional details regarding this.
Great, thanks. Yeah, I'll introduce myself again real quick. Jeanne Ehmke. I work for Opportunities for Ohioans with Disabilities, and I'm a work incentives consultant. So I went through training to learn about how to understand benefits and, help explain them and help people understand them better. So if you want to go to the next slide, we'll get into talking about employment with Medicaid. Oh, there we go. Okay. I couldn't see it all at first. Okay. So we wanted to give some examples because as you can see, there's a lot of different ways that people can become eligible for Medicaid. So they call them categories. They all have slightly different, income rules, some difference in resource limits, like we talked about, especially with Medicaid buy-in having a much higher resource limit, which is great. But sometimes it's confusing with how they can interact with each other. And the other thing I think that, I had to learn was to think through is that someone could actually be eligible for Medicaid in more than one category at once. So a lot of times that's going to be to their advantage. So for what is great is in this slide, we talk about someone who has a Medicaid waiver. So one of those home and community-based services waivers we mentioned previously. And they also are someone who's eligible for SSI. So SSI will be SSI disabled Medicaid eligible is when you're receiving any amount of an SSI payment. So it may be a reduced amount of SSI due to work, but you're getting some sort of check that's an SSI payment. And then 1619B, like Latosha went over, is for people that are they're technically eligible for SSI still, but they are at the point where their income from work is high enough that it's made them not eligible to actually receive a cash SSI payment anymore, but they still have that eligibility kind of in the background there. And they've gone into the 1619B Medicaid versus the SSI disabled Medicaid category. So when someone's in one of those situations, plus they have a Medicaid waiver, what is great is those people are not eligible are not subject, they're not subject to a patient liability or what sometimes they'll refer to as a share of costs for their Medicaid. So that's good because just the Medicaid waiver by itself, when the income is over a certain amount, call it like the needs allowance amount, the person could be subject in some cases to paying a specific amount based on their income towards their waiver services that they receive. So, but if you have SSI Medicaid, 1619B Medicaid, there is no patient liability / share of cost. So we have a little example here with Ron. So he actually receives SSDI and a small amount of SSI. So he's SSI disabled. He has SSI disabled Medicaid in this situation because he gets $87 in SSI when he's not working. When he starts working, he starts a part-time job and he starts earning $1,000 per month. The way that works out, which if you've gone to other SALT talks, it sounds like they've gotten into the specifics about how SSI might be calculated when you're working. And so what that does is it's enough income where that $87 is not received anymore. But he switches from SSI disabled Medicaid to that 1619B Medicaid, which is great. And in this case, with the earnings level, he still is receiving that $900 in SSDI. So we add those, the SSDI payment with the wages, and that results in total income per month of $2,100 for Ron. This is technically over what they call the waiver needs allowance, which is the point where you might have to pay that patient liability because the total income is higher. This year, that waiver needs allowance is $1,886 per month. And then they give you an extra $65 disregard if you're working. So really, you can think about it when someone's working is in any income over $1,951. So because he also has SSI, eligibility still through, and he has 1619B Medicaid, there is no patient liability like there would be for someone that wasn't, that didn't have the SSI or 1619B eligibility. So he is categorically eligible for Medicaid, which is the 1619B, and therefore there's no patient liability. So he is not paying anything out of pocket, nothing changes. With that additional $1,000 per month from work, keeps the Medicaid eligibility and keeps the waiver services eligibility at no cost. So you can go to the next slide. Okay, so this would be another situation with someone who has a Medicaid waiver. And in this case, this individual does not have any SSI eligibility. So there's no SSI Medicaid, there's no 1619B Medicaid. But someone is working, they can become eligible for that Medicaid buy-in for workers with disabilities, which also states in their rules, if you have Medicaid buy-in for workers with disabilities, you are also not subject to a patient liability share of cost. So if we look at Tish, she has a level 1 waiver, and she is receiving SSDI of $1,300 each month. She also starts working part-time and is earning $1,000 a month. So just kept the math really simple here. So now she has $2,300 in total income per month. Again, like with Ron, she is going to be over that waiver needs allowance amount for this year of $1,951 since she's working in income per month. So she would, so you usually don't have to request it, but sometimes we say just, make sure you do. Job and Family Services should be looking when someone reports that they're working. And if they are already in like the system receiving any kind of benefit through them, they would be looking to see if they qualify for any types of, Medicaid or other benefits. If they're not, it's just simply if Tish didn't have any other benefits through Job and Family Services already, or she could just apply for Medicaid. Basically, she's working. Medicaid buy-in is going to be the best Medicaid category for her because she will not have the patient liability. Well, actually, sorry, I wasn't thinking that through. She is in JFS's system because she has the Medicaid waiver, and that's another type of Medicaid. So they would just see that she's working now. And in theory, it should just happen where they make her eligible for Medicaid buy-in to allow her to keep the Medicaid eligibility and the waiver services with no out-of-pocket cost, even though her income has increased. Yeah, you can go to the next one. Okay, so we have some information here, some more links about applying for Medicaid. So there are several different options. People are comfortable, I know, with different ways of doing things and applying for benefits and services. So online is always an option. So we have the link there. It's the benefits.ohio.gov. You can always go in person or mail a paper application that you can download, which we have the link there for the application. You can call the Medicaid Consumer Hotline and apply, and we have the phone number listed there for that. And then there's a link for there with actual like kind of step-by-step instructions on how to apply. Okay, next slide. Okay, and then here are some links just for additional information. We have the Medicaid Consumer Hotline again. You can call the 800 number there. There's the website, Medicaid.ohio.gov homepage with the Contact Us link. And then there's additional about the specific different kind of categories and Medicaid programs, it says here on this third link. And then there's also the option to contact whatever county you're in, that county Job and Family Services office. And we have a link to the directory if you don't know the contact information for the county that you're in. Okay, next slide. We have some additional resources. So I don't know if we need to read all of them, but yeah, Ohio Medicaid checking. The second link is to check your eligibility. And then there's one to, there's, what to expect, kind of information about applying. There's a link about waivers, specifically home and community-based services waivers. There's a link to the information about the Ohio RISE program. And then the last one is a link, some or all of you may have already heard about it, but there's a really nice webpage called DB 101, so Disability Benefits 101, that is customized. This link is the one that's customized for Ohio, and that webpage has videos that explain different things about benefits and work incentives. It has estimators where you can estimate eligibility and amounts of premiums for Medicaid buy-in if your income is at a point where you might owe a premium for that. It's a really, I'm sure there are other things on there that I'm not thinking off the top of my head, but it's a great website to go to for some information. And it's especially nice if you, we refer people a lot to there. Latosha and I do a lot of meetings where we do specific customized benefits reports for people. So benefit analysis, work incentives planning, that kind of thing. And then definitely after you've had that meeting, you're going to know for sure, if you didn't already, what specific type of benefit you have. So we then encourage the DB 101 website, maybe just if you want a quick update, something's changed, maybe you got a raise at the job you were working at, so something might change with your benefits. That's a good place to kind of go. It lets you go through answer a series of questions, and it will kind of let you know what you might need to know about benefits, or if there'll be any changes with your benefits you want to know about. So I think that's, yeah, I don't know, there's some question. I guess we can do questions in a minute. If you want to go to the next link, I think we're actually almost at the end here.
That's the last page that I have.
Is that our last one? Oh, it is our last one. Oh, sorry. Yeah. I thought we had one that just said questions, but I think we did.
So I think there are some questions, and I will read them, and either you or Latosha. So let me go back and make sure I got because I see, let me just make sure I get the first question here. Okay, got it. So the definition, someone wants to know the definitions of the MBIWD. What's it stand for? Do you know which slide? I can go back to that one.
Was it 7 or 8? I want to say towards the, yeah. Let's see.
9.
Yeah, it is the Medicaid buy-in for workers with disabilities.
There it is.
Yes.
So yeah, and these slides will be this presentation is available. We had a link in there and we'll reshare it so you can go in and look at it as well. Oh, I did see where Latosha answered that one. Sorry, Latosha.
Oh, no, you're fine.
So then the other question, it looks like you answered that as well, but someone had asked, ODJFS recently contacted us to complete employment verification for my son who has a level 1 waiver and SSI. She said we are required to report employment and changes employment to them. This is really required when he is currently receiving the waiver and SSI question. We never were told this in the past. So I don't know if you want to elaborate on that anymore, Latosha. I do see you answered that.
Yeah, so for anyone that's receiving Medicaid services, do have to report any changes to employment or to notify Job and Family Services of any new employment. I have seen that some individuals have reported that maybe JFS never requested this before. I do feel like during the pandemic, a lot of information probably wasn't requested, and some individuals were automatically renewed for Medicaid services. But if you get any requests from GFS requesting any verifications of anything, please provide that information, because if you do not provide it, they will terminate Medicaid due to not providing the requested verifications.
And just to make or when our sons first got a job and different things, and we had Medicaid, the Medicaid buy-in. At that time, the difference is we were like around the resources, like this is a couple years ago now, but it was 11,000. So it goes up, as they said, limits may increase annually. Obviously it did since when we were involved. We were like right around the 11,000 mark, I think, for this resources for the year. So that's interesting to compare. I did have a question. I think I got all the questions that were in the chat, but the question, I'm going to go back to slide 6 real quick. One term that was new to me, and maybe I'm the only one on here, I'm not sure. I only heard it once before, was this qualified income trust, the QIT. Is this something like when we meet, because we always look at, stable account and trust and stuff. Is this something we should be bringing up with when we do look at the different trusts with whoever we're setting the trust up with? Is this something we need to inquire about, or is it a common, how would I say, discussion?
I would say Latosha might want to chime in differently. I haven't seen, I don't even know if I've ever had anyone that's actually ended up needing to set up the QIT. So it's something that can be worked around, the need for that QIT, by becoming eligible for the Medicaid buy-in. So basically, kind of, if you have the Medicaid buy-in, those rules about income limits and resources kind of switch over, and those rules for Medicaid buy-in kind of take over. So it's much higher. You can have much higher income, and there's not a need to set up the QIT if you get in Medicaid buy-in. So that's why I've not really ever seen, I don't think I've ever seen anyone. It does obviously exist for a reason. There might be some people that need it, but I think it's more often people that are not able to work maybe, and they have a high, perhaps one time, I'm trying to think back. I think actually one time I did work with someone. They had already had it set up, so I didn't have to help them or give them advice about it, but it was because they received a disability payment from a parent's work record that was fairly high. Plus they received a OPERS, pension, like a benefit from the parent also. And basically just those two amounts of unearned income were high enough to kind of go over that limit. And they also needed the waiver services. So I don't know if those are usually the situations where it's unearned income. And so there's no, getting Medicaid buy-in requires you to work some. So that wasn't an option for that particular person, but that's the only situation I could think of. I don't know, Latosha, have you?
I had a couple individuals, and it's the situation like Jeannie was indicating that they're unearned income, like OPERS, or they're getting a pension from their employer, or some other benefit that maybe someone, maybe a parent, filed a lawsuit and they're getting like residual payments from this lawsuit, and it's causing them to be over the income limit for the Medicaid waiver. So they was required to open up a qualified income trust in order to be eligible for the Medicaid waiver, but they do have an option to use some of the money that they're putting into that QIT trust to pay for approved medical expenses. So it doesn't like just go into that trust and they can't touch it. They can use it for approved medical expenses. And I would like to share that JFS will let them know in advance if they would have to open up a qualified income trust. They'll get information directly from JFS indicating their income is too high and that X amount of dollars would have to be put into this qualified income trust in order to be eligible for that waiver program. Typically, that's what I've seen.
Is this something, and maybe, is this something that the stable account, like people use the stable account for these excesses too, or is this totally would have to be this QIT?
The QIT, because with the stable, you can't use the stable to shelter income. You can only use it for, savings. So any income that they receive in the month will be counted as income. And then anything that's saved after that month is counted as a resource.
Okay, that's a good point. Yes. Okay.
But I haven't seen it happen too often, but I am aware of a couple people that because of their unearned income, they are required to open up a qualified income trust. Even for I have one individual that he's working, but even with his employment, his unearned income is so much higher that it cannot be excluded under the MBIWD in order for him to meet eligibility. So.
Yeah, I've only heard this term once in the number of years that I've been involved in SALT. So that's when I saw it. I wanted to know a little bit more around that. So I don't know if anybody else on this call has heard that term or not, but it's good information to know, especially as our child progresses into these stages. All right. Is there any other questions for our speakers? And then I'll close the recording if anybody needs to would like to verbally verbally like to ask any of their questions. I'm just looking here in the chat. I think we have covered all the questions that were in the chat. All right. Well, I'm gonna close the recording. I want to thank Latosha and Jeannie for your information. If someone leaves this session this afternoon and they're like, oh, I should have asked this, are you able to put your email contacts in case someone has a question? If they're looking at this PowerPoint later and they're like, I don't quite understand this point, would you be able to add your email to the chat box so people would know how to reach out and ask? And then maybe you can redirect them to, depending what county they're in, or to a benefit analysis person within their location.
Yeah, for sure. I'm just going to type my phone number and email in the chat right now. So yeah, but feel free, and you don't have to worry about, I cover quite a few counties, and if you have a question and something that needs more, more work or something, I can always, I can figure out who you might want to talk to if it's not me. So I'm thinking Latosha could do the same probably.
Yeah,
So.
and I'm adding my information as well. And like Jeannie said, if there's someone else outside of us that you need to speak with directly, we probably have the contact or a way to get the contact for you.
Wonderful. Thank you. Let me go ahead and I'm going to close the recording, and then we'll open it up for any other questions that someone might have without being recorded. So Thank you again, Jeannie and Latosha. And 1 second.
Thanks.